Thank you for being here. I want to welcome all our attendees, first timers, new members. I appreciate seeing your faces and the support. I want to welcome everybody, and it's such a fantastic time that we are learning more and more about plant-based nutrition and seeing that more and more people are transitioning. We will no longer be the odd man out in this world. So as plant-based nutrition support group grows and these virtual events educate us, it's just a very exciting time, and I want to thank you all for being here. I want to recognize our founder, Paul Chatlin. He could not be here tonight, but he's the face of an amazing inspirational story of going from nearly dying to strong, vibrant, and healthy through a plant-based diet. I want to recognize Marion Treese, our administrative director, Lisa Smith, our executive director, and Brett Nyquist. All of us worked hard together to support the community across the nation so that everyone can find success in this plant-based lifestyle. For those that are new to PBNSG, PBNSG stands for Plant-Based Nutrition Support Group, and we are a nonprofit organization dedicated to evidence-based education and advocacy of plant-based whole foods nutrition to help individuals prevent or reverse chronic disease and achieve optimal health. As you all know, you are members of PBNSG. Please spread the word that as being a member, we support you through virtual events like tonight, our specialized groups. We have 10 specialized groups that hold monthly meetings, our discussion chat board, and so much more. So spread the word. We want to support as many people as possible. And for those that don't know me, if you're new to the membership, my name is Megan Burt, and I'm director of support groups for PBNSG. I've been plant-based for going on 16 years now, and I have a 5-year-old plant-based whole foods toddler, and he's my inspiration towards helping others find success in this plant-based life, especially with the younger generations. That's my biggest passion. I want to let everyone know of our upcoming events. We have on July 22nd, Chef Karen Dugan. That will be a culinary event. July 29th, Adam Sudd. August 5th, D. Anthony Evans. August 12th is our community support group meeting with Michael Smith. That's our free event that's open to anyone. It gives people a real taste of what these meetings are all about. It's a much more relaxed format with time for questions and answers. So it's always the second Thursday of each month. Spread the word, the more the merrier. And then August 19th, we have Anthony Disson, and August 26th, we have Dr. Neil Barnard. So lots to look forward to. I also want to let you guys know that we are in the process of creating PBNSGU, U standing for university. We will share more as it gets closer to opening date, for lack of a better word. So without further ado, let me give the bio and background to our speaker tonight, Monica Agarwal, MD, as she prevents on inflammation and chronic disease. Dr. Aggarwal is a clinical associate professor of medicine at the University of Florida, Division of Cardiovascular Medicine. She received her medical degree from Virginia Commonwealth University School of Medicine and subsequently went on to complete a residency in internal medicine at Tufts New England Medical Center. She then completed cardiology fellowship at the University of Maryland and later continued her training at the University of Arizona, where she completed an integrative medicine fellowship. She has instituted plant-based menu at the University of Florida Hospital, which is receiving national attention, along with new discharge education that empowers patients to heal their bodies with their lifestyles. She was recently named Florida's Cardiovascular Researcher of the Year, which provided her with a grant to conduct the important research needed on nutrition. I'm going to let her have the floor. Thank you, Monica, for being here. I'm going to put your website, Facebook, Twitter, and Instagram in the chat box. And don't forget, this recording will be available in your portal to view later, so you can refer back to these links. So thank you, Monica, for being here. I'm going to spotlight you, and you now have the floor.
Thank you so much for having me. Just going to turn on my slides. Hi, everybody. Let's see. I don't know what it means that you spotlighted me. Usually I share the screen.
Oh, I just meant like when you're talking, you are now, you're the face that everyone sees.
Gotcha.
But yes, your screen's being shared.
Okay, great. Okay.
Nice to see you all. I'm sitting here
in sunny Florida, and it is a lovely hot day here, and I was hanging out with my 3 kids this morning and all day today, so it's been really a sort of a fun sticky Thursday. So I thank you for the kind introduction, and thank you for having me here. Can everyone hear me okay? If you could just give me a thumbs up, it just helps me. Perfect. Thanks so much. So I was going to do a talk. So I'm a talk today about sort of how I got into nutrition. I and why nutrition is important for cardiac disease, but just in general for chronic illness. So I am a cardiologist. I'm a preventive cardiologist. So I take care of people with advanced heart disease and people who are just interested in being healthy and keeping their heart healthy. So I'll see people who are getting heart transplants. I see patients who need to get bypass surgery. I see a lot of patients who come in for consults that because they were told they needed stents or procedures or bypass surgery, and they want to know, do they need that actually? They've been told that they have a lot of risk for heart disease and they want to know what to do. These are the kind of questions that I see in my clinic on a daily basis. I put my social media up there because people often want to ask questions there. So why am I here? So I'm a daughter, I'm a wife, I'm a mom, I'm an athlete, but I'm also a patient. So here I am, as big as my husband once said to me and got really in trouble for it. He said I really looked like a whale, which is not allowed to be said. I've also been told many times that I look like I was carrying twins when I was only 5 months pregnant. So I've heard the gamut of comments when I was pregnant, but I was humongous. And there's me pregnant with baby number 3, and there's baby 2 sitting next to me. So I finished my cardiology training, and a lot of us women in subspecialty medicine, it's complicated to be in subspecialty because there's so much demand and expectation, and we're also there's sort of this unsaid rule not to get pregnant when you're training. And while it's not, if I said that to some people, they'd say, well, that's not true, you can. Well, it was looked on, it was let's just say it was frowned upon. So when I finished my training, which I trained for almost 18 years, I decided that I wanted to have kids, and since I wanted to have 3, I really needed to have a lot quick. So I had 3 kids under 4. And often when I tell people, I say, well, I used to come home and I'd carry one in my arms, one would be on the breast, and usually one would be attached to my leg. And that's how I lived. So here I am pregnant with baby number 3. And there she is, baby number 3. But after 4 months after baby number 3 was born, I started developing joint pain. It started out with my finger, and then it quickly migrated to my knees and my shoulders. I went from being an athlete, and over 2 to 3 weeks, I was almost immobile. In the hospital, I would find the elevator, which is so unlike me because I'm always the one running up the stairs, but I had to hide to find the elevator because I didn't want people to see there was something wrong with me. I remember that there was this glass feeling in my feet. I used to think that there was something wrong with my shoes because every time I'd step, I felt like glass was cutting my feet. So within a 3 to 4 week period, I went from being completely active and a runner to completely immobilized. I remember the moment where I really knew I had a problem. This is maybe the darkest part of my story and sometimes hardest for me to tell, but it happened when I remember there was a day, it was 4 or 5 in the morning, and I'd run down or wobble down the stairs to let the dogs out in the morning and start the morning routine of nursing, pumping, making baby food, getting ready for the daycare, getting my lunch ready. And the baby cried. And I was worried that the baby would wake up the 2 and the 4-year-old whose bedrooms were nearby. So I started running up the stairs, but I couldn't get up the stairs that day because my joints wouldn't allow it. I crawled up the stairs that day. And my husband remembers finding me at the bottom of the crib crying next to the baby, crying because I could not get the baby out of the crib. So like any good doctor does, I treated myself for Lyme disease because I figured that I had migratory joint pain and I was in a wooded area. I must have Lyme disease because I'm a physician and I know best. And I got worse. I got worse and worse. And so much so that I finally got my blood work done and all my inflammatory markers were through the roof. In fact, my inflammatory markers were so high that I didn't even get a number. I got a greater than. And I was told that the numbers were so high that I had a debilitating form of rheumatoid arthritis. I was told that it was so severe that if I didn't get on medications within a week, that I probably would have significant destructive disability. I was nursing my baby. I was 5 months postpartum. I was nursing, and if anybody's ever nursed a baby, that's a very special and important thing. And it was for me. And somebody taking that away from me nearly destroyed me. I got started, but I did it. It took me a week. It was maybe the hardest week of my life, where I had to walk away from my crying baby with milk oozing from my breasts because I couldn't feed her. So I could get on the medications that the doctors wanted me to get on. So within a week of my diagnosis, I got started on all of these medications, and I got better, but I also got worse. So I started having symptoms and side effects of dizziness, and I had a metallic taste in my mouth all the time. People used to admire how I'd lost my baby weight so quickly, when I just didn't feel like eating ever, because of that metallic taste. I had diarrhea, significant anemia. I was dizzy all the time, and I lost a lot of my hair, but I got better. So how did I feel? I felt like most people who've ever been a patient before. I was scared all the time. I was emotional and fragile. I was unable to understand. I didn't feel in control. And I was really angry at my kid because I wondered, if I hadn't gotten pregnant and had a third child, maybe all of this wouldn't have happened. So I continued to work and got better and worse, depending on if you believe the joints got better, the side effects got worse. And then I met a woman named Karen, and she was a nutritionist, and she wanted to come to one of my events where I used to run these community screenings for blood pressure and cholesterol, and she wanted to come and teach people about nutrition. And I thought, oh, no, I got this. I know what I'm doing. I'm vegetarian. I know what I'm doing. And she said, well, let me do your profile. And that was the first time that maybe I had actually made a connection that there was something I could be doing with my body, with what I was eating, that maybe wasn't as healthy as I thought. She also started making me think about other lifestyle things, like, do I sleep enough? How does my food impact me? How much do I do for myself? And how much is my day is stress? I thought about changing diet. I thought about what it all means. Could I be a doctor and then actually change my diet, and use diet to make myself better? I mean, how crazy is that? Doctors don't do that. We use science. We use medicines. I thought about whether there were things that I was doing in terms of my stress levels and sleep and exercise and diet that could impact my body. And maybe there was a chance I would get off my medications, or could I never? The rheumatologist told me I will never get off my medications. He told me that there was no cure for my illness, and I just needed to get used to it, quote unquote. And I still continue to keep that anger for my kid, but I was at a fork in the road, and I had to figure out what I was willing to do, whether I was willing to make a choice, and whether I was really going to try to use nutrition and change my lifestyle to give myself a shot. So I took a leap of faith. And I was already vegetarian, so I did a significant elimination in my diet, and I'll talk a little bit about that. I changed and added back a lot of healthy anti-inflammatory foods. I focused on sleep and cutting stress and mind body. How did I feel? Immediately better. Immediately better. Here I am doing yoga. Here I am a couple of years later with my kids getting older. Now that little shrimpster is on the bit way left. And I haven't looked back. I did my first triathlon. I remember this day in particular because it's 2 weeks before this triathlon that I stopped all of my medications for rheumatoid arthritis. And now I am 8 years after my diagnosis. There's the team. 7 years with lifestyle changes, 9 years since 6 years since I've been off medications, and I'm not looking back. So why do I tell you this story? I start that story because I think it's important to know that I'm just like you. I'm just like everyone else. We all get sick. Sometimes we as doctors are cocky and obnoxious, as I was, because we think that we are better, or we don't, or that we understand everything better because we went to medical school. But the sad reality is in medical school, they don't teach us enough about how to eat, how to live our life, and how to improve our lifestyle to improve our health. So I come to tell you this story because lifestyle actually does work. A diet can change your body. So I moved out of my private practice. I wrote a book called Body on Fire to honor my kid, who I blamed for all of my illness, but was actually my savior. And I switched into academics, and I became and started teaching nutrition to the younger generation of doctors. So let's go down the rabbit hole a little bit and talk a little bit about some of the data and what we've learned along the way. So we know that heart disease is the #1 cause of death, but actually the top 10 causes of death in the United States are primarily preventable. And I think that's important to see because stroke and Alzheimer's and diabetes and kidney disease and cancer are all in that top list, and most of them are largely preventable. I think the important way to think about disease is that they're all sort of connected. It's not true that, so our genetics are all different because we can't change our parents, but they're all connected in that how they're activated and how each person is going to get the illness that they genetically are predisposed. But whether that gene is turned on and off is really dictated by your lifestyle. So if you believe that all your illnesses are connected, what's that single prod in the middle that connects all of these illnesses? Well, that's inflammation. I always tell people that inflammation is your body on fire. It's how your body's mad at you. And why is your body mad at you? Well, it's something you're doing to it. So imagine this. Imagine that you have a genetic predisposition to illness and there's some second hit, maybe a lifestyle change that you do for your body that then triggers you to have an illness, which then triggers inflammation. As physicians, we're taught to treat the illness and treat the inflammation. But what if you think of it differently? What if you say that genetic predisposition is, and that second hit is that lifestyle, but that triggers inflammation, and that inflammation actually activates the gene, which triggers the illness? If that's the case, then the treatment is rather to change the lifestyle and to change the inflammation, decrease the things that trigger inflammation, which then trigger the activation of the gene. I've always had the gene my whole life I had the gene for rheumatoid arthritis, but why did I get it at the time that I did? Was it hormonal changes from pregnancy, which is what most of us believe? Is it also related to the lifestyle that we had at the time? Absolutely. And so if you change those lifestyle changes, maybe you wouldn't activate the gene, maybe you wouldn't express that gene. And maybe if you change your lifestyle back, you can actually suppress the illness. So there are many lifestyle factors that can trigger an imbalance in our body and trigger that inflammation. So I like to think of it as the stresses and the resources that our body has. So the stresses that our body has, we got a lot of them. We have a lot of stresses like poor sleep and mental stress, social media, water pollutants, processed foods, poor inactive lifestyle, environmental toxins. These are all things that happen to our and poor diet. And these are all things that are stresses on our body. There are so many resources that we have, and we can't forget things like exercise and yoga and clean water and meditation and restorative sleep and eating more plants. So it's a balance to sort of improve and make sure that our resources outweigh our stresses. Imagine your phone, and when your phone hits 7%, you panic and you run and find a charger and go charge your phone. But we've forgotten how to recharge and charge our bodies. We're so stressed all of the time. We're overdoing it. We're living on 4 or 5 hours, or we're eating poorly because we don't quote unquote have time, or we're not active as much. We just don't do things to restore our body. But like we do to our phones, why don't we restore our bodies? So why did I get rheumatoid arthritis? Well, I had the genes all the time. The genes were always there. And the lifestyle triggers the inflammation, which then activates the gene expression. It's a different way to think about illness. So now if we think that inflammation triggers illness, and that our key to all of our illnesses is that inflammation, then the key has to be to not allow inflammation. And if we talk about things that trigger inflammation in our body and our lifestyle, we talk about those resources versus our stresses, and we want to have more resources than stress. So let's specifically focus on diet because this is a plant-based support group. And so when we think about diet, consider that diet actually, well, how does that actually trigger inflammation? Well, the diet is when you eat those foods, it goes into your gut. And so and your gut actually, some people believe, is like your second brain. And that second brain has the ability to trigger a lot of inflammation and then trigger illness. Let's talk about that. It's always about poop. My kids love that. So inside the gut, you have all these bugs. And it's important to understand that we all have them. The key is to have healthy bugs and not unhealthy bugs. And you don't have to read all these slides because I'm going to talk to you about them. It's more for people who might be watching later. So if you think about all the bugs, you have about 100 trillion bugs on your skin and in your gut and in your rectum and in your anus and in your vagina and in your penis. All of those areas have bugs on them. We don't like to think of it that way, but we do. They're mostly bacteria, but there's some fungus and there's some viruses. And that's important to know because all of those bacteria have their own DNA. So if you think about it, that 90% of the cells of our body are actually bugs and only 10% are human. So some people like to joke that we are more bug than we are gut. And that's why people think the gut is your second brain. But here's another thought. So each of those bugs has their own DNA. So then all that genetic material, is it just sitting in that bacteria? No, it actually impacts your whole body. So the bugs in your gut and the gut organ has the ability to make a lot of hormones. And those hormones, some of the hormones that they make are things like serotonin. Well, serotonin is the happiness hormone. So you can consider that when you're depressed and down, what happens to your gut? You get diarrhea. Or think of it the other way. When your gut is unhappy, don't you feel down? So there's so many things that can happen with your gut. There's so many, histamine is made in your gut, serotonin, dopamine, which is your get up and go. So there's so many things that your gut makes along with your brain that then impact how you feel. So if you consider that, then it's very important to nurture all those gut bugs. Well, those gut bugs are interesting because they change depending on who you are. So they change based on if you were born by a vaginal delivery, then the baby is going to actually have the bugs that are the same as the mom's vagina, but if the mom in their gut. But if you're born by cesarean section, the bugs of the baby are going to be the same as the skin of the mom. So even from the moment you come out of the womb, you will have different bugs depending on how you're delivered. You'll also change your bugs based on when you start breast milk, or if you have formula fed, if you have a fever, if you get antibiotics. All of these things change those bugs in your gut. But you can also change the bugs in your gut with the foods that you eat. So there's so many bugs in your gut. It's not even worth trying to remember the names of the bugs because we don't even understand all of them. But we do know that there's certain bug classes that seem to be associated with healthier foods than unhealthy foods. We also know if you eat a high fat diet, you have low P's. Let's call them P's so we don't get confused. And we have high F's. But then if you decrease the fat in your diet, you increase the P's. We can also know that if you increase fiber, you increase the P bugs. So, we also know that if you have low levels of those P bugs, that's associated with more cancer and inflammation and obesity. So here, the bugs in your gut matter. Depending on what you eat, you can have different bugs, which then can trigger different types of inflammation. So let's talk about a study, which is kind of fun because this is kind of a crazy concept, which is that we have to worry about the bugs in our gut. Like what? You're a cardiologist and you're talking about gut bugs. So I think it's important to think about it this way. So there was a study done that was kind of cool. And they looked at African Americans and Africans. So the Africans were eating kind of a classic village diet. They were eating mostly yams and potatoes and starches and carbs and beans and greens. And then the African Americans were eating more of a standard American diet, which was more like fast food and McDonald's kind of food and low fiber and low fruits and vegetables. Well, they found that the people that were eating more of the village diet had more of those P bugs. And the people that were eating more of the Western style diet had more of those B bugs. And remember, the P bugs are the ones you want because those are the ones that are associated with less chronic illness. We also know that the P bugs are the ones that actually make more short chain fatty acids, which are anti-inflammatory. Anti-inflammatory, important to think about anti-inflammatory. So if you get more of the P bugs, you're going to have more anti-inflammatory hormones. So what they did was they took the African Americans and they took the Africans and they looked at their diets, and then they did a colonoscopy. And they found that the Americans, the African Americans, had all these polyps in their gut, and many of which were actually precancerous. And in the Africans eating the village diet, they had almost no polyps in their gut, and almost none. So then they said, well, who cares? People, scientists said, who cares? Maybe that's just genes. Africans are different than African Americans. So what they did was they switched their diets. So they gave the Africans the African American diet and the African Americans the African diet. And what happened? Well, what happened was that all of a sudden we found that there was decreased inflammation in the African Americans and increased inflammations in the Africans. And how soon did that happen? Within 2 weeks. So within 2 weeks of a dietary change, you can change the bugs in somebody's gut, and you can change the inflammatory hormones or the short chain fatty acids. So that's a really important concept to understand, that what you eat in your body, what you eat, you take in, it can change, number one, the bugs that you have in your gut and what your bugs produce. And all of those can trigger or decrease or increase inflammation. Another concept related to bugs and gut is this thing called TMAO. And there's a study that was done that looked at meat and cheese and eggs. And what they did was foods that are high in phosphatidylcholine, they made people eat them. They actually made vegetarians and vegans eat them, which amazes me. And what they did was they fed them this kind of food, and it was radio injected so they could measure, find out where it went, and they could figure out what happened to the meat. And they fed them those foods. And what happens is they found that it goes into your gut, and then it actually goes to your liver, and it makes this thing called trimethylamine N-oxide. You don't need to remember the name, just the concept. We call it TMAO. And what we found was that TMAO in a cell actually triggers inflammation. Wait a second. The meat that you do eat, they studied it, and we saw that it makes something called TMAO, and TMAO triggers inflammation. There's that word again. So what we found was that people who ate the most animal products like red meat, eggs, and cheese had the most amount of TMAO. And the people who had the most TMAO had the highest amounts of heart attacks, strokes, and death. So what you eat matters. What we found that was more interesting was that the vegan and vegetarian was given the red meat as well. And you can see here that the omnivore, their TMAO level goes up like this, whereas the vegan vegetarian has almost no increase in that TMAO level. So it suggests that the bugs of the vegan vegetarian are totally changed. And even if they once in a while ate some animal products, the TMAO isn't released because the bugs are totally different. But look how quickly the TMAO levels go up within 12 hours of eating that meal. So within 12 hours of eating animal products, if you're an omnivore, you can increase your TMAO levels. And we know that high TMAO is associated with more rates of heart attack, stroke, and death. What you eat matters. What you eat impacts what goes into your body, what bugs you make, and what your bugs produce. And what your bugs produce will decide if you're going to have more inflammation or less. So there are many other bugs many other things that your gut makes. Endotoxin, which some of you may have heard of, or lipopolysaccharide. All of these things are made when you eat high-fat foods and decrease when you eat low-fat foods. There's so many things that are being discovered on a daily basis, and I don't want to overwhelm you with bugs. I just want you to remember some basic concepts, that there are bugs all over you. You're made of all sorts of loads of bugs all over you. They change from when you're born. They change with your diet. They change with antibiotics. but most importantly, they change with the foods that you eat. Likely there's part of the component is the mechanism is through the leaky gut. So wait, what you eat in your body matters? Absolutely. But is it everything? So this is one of my favorite slides, and I like this slide because it talks about genes versus lifestyle. So on the x-axis is genes. So like your genetic risk is low, intermediate, or high. And on the y-axis is calcium in your heart arteries. The blue is a favorable lifestyle. The red is an unfavorable lifestyle. So people say, well, my parents had heart disease. I'm going to have heart disease. It's just what the cards say. Is that really true? Well, if you look at somebody who has a high genetic risk, so you're at high risk, mom and dad had heart disease at a young age. Well, if you eat an unfavorable lifestyle, you're going to have a high risk of having plaque in your heart. But if you have high risk and you have a favorable or healthy lifestyle, you can reduce your risk by 50%. That's just by changing your lifestyle. Similarly, if you have a low genetic risk, that doesn't mean that means your parents were super healthy and lived till they were 145. Then you can say, well, okay, you can say, oh, I'm going to do fine. My parents lived a long time. Is that true? Well, not necessarily. You can see here that if you have a favorable lifestyle, you're here with a very low amount of plaque in your heart. But as soon as you start using that unfavorable lifestyle, you double your risk of having a heart event or heart plaque. So you can change your genetic profile based on your lifestyle. The most common reason for people to die in the United States is no longer tobacco smoking, it's dietary risk. Dietary, what's wrong with the foods that we eat? Well, it's primarily red meat, refined grains, processed foods, high fat dairy, dessert, high fat sugars, and eggs. 75% of the food that we eat now in the United States contains added sugar, and that's mostly coming from our sugar sweetened beverages. I love to show this slide because people love this naked drink because they think they're eating this very healthy juice. Let's have this juice. Well, there's 60 grams of sugar in one naked drink. Well, how much sugar is the right amount of sugar, Monica? Well, I'll talk to you about that in a second. If you have a soda or a juice, you're getting about 77 grams. What about that iced coffee from Starbucks? 31 grams of sugar in just one 9-ounce bottle. The average meal no longer looks like this, which was in the 1950s, and now looks something like this. And now the obesity rates have gone from high to higher. And our children look more like the guy on the right than the guy on the left. With that, what's happened? Well, our guidelines have changed, and now 50% of Americans are considered to have high blood pressure. 50% of humans. In fact, I teach people about blood pressure, of course, and my trainees, my fellows, they're called fellows, our cardiology trainees. I remember after the guidelines came out, they all came and sat next to me and said, Monica, we all have high blood pressure. And so I said, okay, or what do you want to do about it? And they're like, okay, teach us how to fix our diet. And all of a sudden the world changed. 50% of Americans now have high blood pressure. About 11% to 13% of high cholesterol, and nearly 30% of patients are diabetic, and nearly up to 70% of the patients are overweight and obese. What's wrong with what we're eating? Well, most of the time we're eating too much sodium. We're eating low amounts of nuts and seeds, high amounts of processed meats. If we're eating fish that has low amounts of omega-3. We're eating low amounts of vegetables, low amounts of fruits, and we're loving our sugar sweetened beverages. We eat grains, but we eat the wrong kind of grains. We eat the refined grains, the white breads and the instant meals, and we don't eat enough of the whole grains. So does diet really matter in my world? Well, let's consider this slide because this is kind of fun. And this is the y-axis here, and that's the line of 0. And here's the x-axis where we're talking about effective blood pressure. So you want to be on the left side of this line. So you can see these are medications that some of you might be on, like lisinopril. Well, that works really well, and your blood pressure drops like 12 millimeters of mercury with lisinopril, or metoprolol or atenolol, 13 millimeters of mercury, or diltiazem or amlodipine or Norvasc. Well, you can get a 16 millimeter drop in blood pressure. What if I just cut the sodium in your diet? Well, I can drop your blood pressure 7 millimeters of mercury. What if I put you on a DASH diet? And a DASH diet is a primarily plant-based diet. If I put you on a DASH diet, I can drop your blood pressure 11 millimeters. Well, what about this? This is crazy. What if I put you on a DASH style plant-based diet and I cut your sodium too? I can drop your blood pressure 21 millimeters of mercury. So if you had to choose between a medication and a dietary change, which one would you choose? It's different for everyone, but I know for sure that I would definitely choose a diet. So is there one component of our diet that's worse than the rest? Well, there are a couple of things I'm going to highlight. One is sugar. We eat way too much sugar. If you look at hazard ratio here on the y-axis here, the more sugar you eat, the more events you're going to have. If you look at glycemic load, so this is to think about foods that have a low, that make your sugar levels go up fast or the sugar levels go up slow. So if you eat refined foods like crackers and cookies and chips, then your sugar level will go up like this and your insulin level will go up. Whereas very quickly, whoop. Whereas if you eat things like lentils and quinoa and things that are a little bit more common, bulgur, then you're going to activate insulin. Sugars as well are going to go up, but very slowly. Slowly. And so what happens is that you feel full longer when you eat those complex foods, and you don't get, your sugar level doesn't go up as high. So what happens to people who eat breads and pastas, think about the Olive Garden meal that you may or may not have had in the last couple of weeks. No judgment. So if you ate at Olive Garden, and maybe none of you guys work, or you do work, I don't know, but maybe you went to work or you work at home and you ate that Olive Garden meal for lunch. And then about 20 minutes later, you come back home and you sit down at your computer, and what starts happening? Right? About 20 minutes later, you get the nod. Well, everybody starts falling asleep. Well, why does that happen? Well, it's actually it has all to do with the amount of sugar. So pastas are low in fiber, highly refined, most of them, especially if you're eating them at Olive Garden anyway. And then what's happening is that the sugar level goes up. And then you're feeling like pretty good. You're feeling pretty good. And then about 20 minutes later, your insulin level is activated and the sugar level goes down. And that's when you get the nod. And then your response is to then go and get a coffee. And what do you add to the coffee? Milk and sugar. So then your sugar level goes up again, and then it goes back down again. And so you think, God, I just need to get more sleep. I'm so tired all the time. Or maybe the problem is I need more protein. Well, no. The problem typically isn't you need more protein. The problem is you're eating too much sugar. So this is nice to see. It really does matter how much sugar you take in. So this is the load, glycemic load. So how much, like the sugar burden, or how quickly your sugar level will go up. And this is body mass index, and this is event rate. So the bigger you are with the higher body mass index, and the more sugar you eat, your event rate is going to be higher. So skinny people are like, oh, I'm skinny, I can eat what I want. Well, is that really true? Well, if you're really skinny with a body mass under 23 and you still eat more sugar, your rate of events is higher. So sugar is not our friend. We don't want to be eating it. And we really want to be eating sort of natural sources of sugar, like what? Dates and fruits and sort of healthy sugars, rather than refined sugars that make your sugar go up and then go down. So are all sugars bad? No. There's lots of complex carbohydrates that we want people to eat, and we want to have people avoid the simple carbohydrates. So we don't want people eating sort of the things on the right. We really want to have people eating primarily the foods on the left and some of the foods that are in the middle. How much sugar should you be eating? Well, 25 grams of sugar per day, no more than in a woman, and 36 grams in a man. How much was in that one naked drink again? 60 grams. That's more than your daily allowance for a woman times 2.5. What about the chai latte from Starbucks? Oh, it's black tea. It's infused with cinnamon, cloves, and other warming spices and combined with some milk and topped with foam for a perfect balance of sweet and spicy. How could you not want that drink? That's their advertisement. How much sugar? 16 ounces of sugar, 16 ounce, which is the middle, 42 grams of sugar. Okay, let's talk about fat. Is there such a thing as good fat, bad fat? Is fat bad for you? Well, let's talk about some definitions. First of all, fat can be defined as saturated fat, unsaturated fat, or trans fat. Saturated fat is the fat we've known about the longest and we understand the most about. And saturated fats are the ones that we know increase your LDL, which is the bad cholesterol, and increase the LDL cholesterol, increase the LDL cholesterol, which is the bad cholesterol. And that's the one that we want to avoid because we know that if you increase the amount of saturated fat in your diet, you will get more heart disease. But is that really true? Because Time magazine said eat butter. Scientists labeled fat the enemy. Why were they wrong? I mean, Time magazine has got to know what they're talking about because they said that we should eat butter. So Monica, you're crazy. Well, the truth is we have loads of data, 30 or 40 years of data that say eating high amounts of saturated fat is associated with more heart disease. We do not want you eating it. And we have studies that show that when you move from a saturated fat to an unsaturated fat, you make people better. So there's no question that saturated fat is good for you. The problem is what you replace it with. If you take a saturated fat and you replace it with a refined pasta, this is my Olive Garden meal. I'm sorry if I'm bagging on Olive Garden too much, but this is that refined instant pasta that they make. It has no fiber. They put a little cheese, there's cheese on it. They put a little green to make you feel like you're getting some veggies. And if you go from this saturated fat to this refined and simple carbohydrate and simple sugar, you are going to make somebody worse. But if you go from a saturated fat to a fatty fish or beans or sweet potatoes or very healthy complex carbohydrates, you're going to make them better. So it all depends on what you replace it with. It's not that saturated fat is good for you. It's that what's worse than saturated fat is the simple carbohydrate. And so in the order of things to avoid, the simple carbohydrates are here. Saturated fat is right under. Carbohydrates are not the enemy. People who follow the ketogenic diet, I do not advise that. We stent those patients all of the time. Those patients are getting way too much fat in their diet. And we know from this study that there is such a thing as too much or too little carbohydrate. So hazard ratio again is risk of events. So if 20% of your energy per day is from carbohydrates, you increase somebody's risk. And that's the ketogenic style. If you have too many carbohydrates, you also increase risk because that person's eating all sorts of refined carbohydrates. There's a middle ground, which is about 50 to 55% of your diet, which should be carbohydrates and primarily and truly all complex. What are complex carbohydrates? Oats, brown rice, sweet potatoes, quinoa, whole grains. The only thing I don't like on this picture slide is the Cheerios, but couscous, green beans, all of your beans, these are all complex carbohydrates. These are the foods we want to be eating all day, every day. So if I said to you that we want to eat low saturated fat, high unsaturated fat, what about the trans fat? Well, the one thing about trans fats is what is a trans fat? Well, for a while there, we knew that saturated fat was bad. So we took all the lard out of McDonald's because McDonald's used to make French fries with lard because it has a great shelf life, right? It just sits there on the edge. You might remember from growing up that the lard just sits there on the counter and it never goes bad. It just sits there. And so many foods were easily made with saturated fat. But in the 70s, when all these studies came out that said that saturated fat is not good for you, and you have to eat unsaturated fat, restaurants started panicking because if you start using unsaturated fat, that doesn't keep that well. And so foods start rotting quicker. So all of a sudden restaurants had to create something new. So they created the trans fat. So this is a completely human manufactured product. which is the trans fat, which basically we took unsaturated fats, which are those healthier fats, and we hydrogenated them. And we hydrogenated them so that they would become longer lasting, so they would have a higher shelf life. All that did was increase your LDL cholesterol and decrease the good cholesterol, which is your HDL. So it increases the bad, decreases the good. It's pro-inflammatory. It's associated with loads of illnesses. And sadly, even though there's a national ban, you can still use it in your foods in the grocery store. For instance, many people, restaurants can petition the FDA and say they have to use trans fats in order for their business to have a livelihood. And if you use a certain amount of trans fats that's lower than the FDA recommendation, then you can still use your trans fats and write 0 trans fats on your food. So please look at your ingredients if you're buying something off the shelf, and look if it says partially hydrogenated, walk away from it. It should no trans fats in your diet. It makes everything worse. So animal fats, or why are we so anti-animal fat? So many people grew up eating it. I live in Florida. People tell me, Monica, I'm from Florida. I eat meat and potatoes. That's what I do. I have Cubans who fly up to see us, and people come up and say, this is how they eat. Well, look at the amount of saturated fat in your animal products. There's 9 grams of fat in just one meal, which is 45% of the daily amount just from one meal. But it's not just the saturated fat. It also has cholesterol in it, which you have 89 milligrams of cholesterol in 1 4-ounce steak. There's also loads of iron in animal products, and we are now finding out that there's stuff called heme iron, and the heme iron is pro-inflammatory. Again, there's another inflammatory cause. Remember when we talked about animal products, we said that your gut makes that thing called TMAO, and that's associated with heart disease. So that's another reason not to eat it. There's too much sodium. If you eat a processed meat, it's loaded in nitrates, which is associated with cancer. So if I haven't convinced you before that you shouldn't eat animal products or you shouldn't eat red meat, this slide should tell you, do not eat red meat and animal products. We know that if you have red meat and if your hazard ratio is rate of events, the more animal products or red meat you eat, the more event rate you're going to have. This is a nice slide that I like. This is a y-axis here is 1, and you want to be on the left of this line because that favors plant protein. And if you're on this side, it would favor the animal protein. So if you're on eating processed meat, and this is heart disease, cancer, and other, so if you eat processed red meat, that's like bolognas and salamis, and you change it over to plant protein, you significantly improve somebody's risk of heart disease. That's the same though for unprocessed meat. So those people who say, well, I don't even eat bolognas and those kind of things. I just eat pure grass-fed cow. Well, that doesn't mean that you should be eating that, even though it may be healthier than the processed meat. If you replace it with a plant protein, that's better than what you're doing. The same goes for poultry, fish, eggs, and dairy. And I know people have trouble with the dairy one because there is an emotional connection for a lot of people with cheese. But what you can see is that when you replace these foods with a plant source of protein, you make people better. What about eggs? People love their eggs. Well, what do we know about eggs? We know that eggs are associated with high amounts of so the egg is an interesting product. It has no saturated fat. That's why it's interesting to a lot of people. But the yolk has 89 milligrams of cholesterol in it. And we know that cholesterol, what do we know about cholesterol? We don't know the right amount of cholesterol somebody can take into their diet. You used to think that there was a amount, like anything above 300 milligrams is too much. And that's probably true. Anything above 300 milligrams of cholesterol is too much. And remember, we can only get cholesterol from animal products. There's saturated fat in plant products and in animal products, but there is cholesterol only in animal products. And so if you eat a steak, some cheese, you're going to easily get over that 300 milligrams of cholesterol, plus all that saturated fat. So your cholesterol is now super high because it's not happy about all the foods that you're eating.
And we know that anything above 300 milligrams, if you eat even a half an egg more, you're going to have more rates of heart events. So I always tell patients that we don't want you to eat eggs. But if you really can't give up your eggs, definitely don't eat the yolk. So if not red meat, poultry, dairy, eggs, what should we eat? Because I've really told you like half of your foods I've just taken from you. Oh my gosh. Well, there it is. Lots of this. So if you look at people based on their body mass, diabetes, and high blood pressure, if you look at the non-vegetarian, they have the highest body mass, the highest rates of diabetes, highest rates of high blood pressure. If you go to the pesco-vegetarian, so that's the fish-eating vegetarian who eats cheese still, your body mass comes down, your diabetes rates come down, your high blood pressure rates come down, sure. Look at the vegan. That's the person who eats no animal products. The body mass index is the lowest. The diabetes rates are 80% lower. The blood pressure rates are 75% lower. This slide is very compelling to me because it shows that yes, this being an omnivore or non-vegetarian is if that's the worst option, I would take any of these options, but boy, wouldn't I love everybody to go vegan. The blood pressure goes down when you eat when you eat a mostly or primarily plant-based diet. I'm going to skip these slides because they're a little overwhelming. I do want to talk one slide about the Mediterranean diet. There was a big study because a lot of people like to talk about the Mediterranean diet. I want to emphasize that the Mediterranean diet is a primarily plant-based diet. And so if you look at the bottom of the pyramid, you can see fruits and vegetables, whole grains, olive oil, beans, nuts, legumes, seeds, herbs, and spices. And on top of that is fish. And these top two areas are the no-go zone. You're not to go in those zones. I call that no-go, don't go in the no-go zone. And so, but in general, in the Mediterranean diet, these are sort of things that should be rarely eaten, whereas the primary and the foundation of the Mediterranean diet is a plant-based diet. And we know that when you shift from a standard Western diet and eat more plants, you're going to decrease risk of events. Big deal. We know that. But what's most important is that in the people who eat the Mediterranean diet, who eat the most vegetarian, they actually have the lowest event rate. So the Mediterranean diet, people who eat the most plants do the best. When you eat plant-based, you lower your weight, you lower your cholesterol. This is Neil's work. Your sugars go down. This is Essie's work. Essie's like my dad. I have to tell you that I adore him. I'd love to go hang out. Anne is always messing with me about my hair, or she's like my mom. She's telling me to put my hoodie on or go take a nap, which is always fun. So this is from Essie's group, and you may have seen this slide before, but I just love it because it's a heart slide. And so I do this. These are studies I read all the time. This is a nuclear stress test. And what you're supposed to see is this goldish reddish, which means the blood flow is adequate in this area. And then in this gray area, there's no flow. That means there's a blockage in the heart artery. This is what we do in stress testing. And so this patient elected not to go on a statin and didn't want to get on medications like a statin. And so he just went on a 100% plant-based diet. And after 3 weeks, three weeks, that's crazy, 3 weeks, all of a sudden, look at that stress test. Look at that donut fill back in. So he also had a heart catheterization, which is right here. So this nuclear stress test corresponds to this artery. You can see how beautiful this artery looks, nice and plump here, but look at this ratty little thing. This is not a blood vessel I would want. This means the blood flow is really, really low, but he elected again not to go on a statin. And after 32 months of being on a plant-based diet, look at his blood vessel. I mean, that is really compelling. Yeah, you could say, well, this is only one patient. Sure, agreed. You could say that, well, how do you know this would happen in larger groups? People can't adhere to dietary change. I think a group like this and what Megan's talked about has just shown how many people can adhere. People say old people cannot change their diet. Not true. People say young people don't want to change their diet. Not true. You know, just need the proper motivation to remember that eating plants makes a difference. This is people who compared a vegan diet to a AHA, the American Heart Association diet, and we decrease the inflammation by just changing them further than the normal Heart Association diet. Remember, the American Heart Association recommends a certain diet, but the plant-based diet is better than that, and we decrease inflammation. But there is such a thing as a healthy or unhealthy plant diet. So this is heart events here on the y-axis. And if you eat more H or healthy plant-based foods, you have a decreased event rate under the line there, that red one. But if you have an unhealthy plant diet, look at that, boom, goes up. You increase your rate. That's why I tell you that those unhealthy carbohydrates and unhealthy carbs and those fats that are saturated, we want to avoid, because those are the foods that make you worse. There is such a thing as a healthy or unhealthy plant diet. Remember that French fries are vegan or plant-based, but they are not whole food plant-based. Most of these chips are plant products. Coca-Cola is actually a plant product. Oreos are a plant product, but these are not the foods we want you to be eating, and we really want you to be eating foods more looking on the left. So how do I advise my patients? Well, sometimes I don't sweat the small stuff. Some people will say, you know, I want to eat Mediterranean. I will say, okay. Some people will say, I want to eat DASH. Okay. Some people say, I want to eat plant-based Essie style, and I'll say, okay. Some people will say, oh, I can't do that. I want to just eat more plants. I just try to emphasize this slide, which is that anything you do that we different or better than the standard American diet, we're going to make people live longer. And that's very important to understand. And that the foundation for all diets, DASH, plant-based, Mediterranean, is more plants. And so if you focus on just eating more plants, you're going to make yourself better, healthier. Your blood pressure is going to go down. Your cholesterol is going to go down. Your heart disease risk is going to go down. Your inflammation is going to go down. The average American eats about 30%, eats about 30% of the I'm saying that backwards, sorry. About 30% of the US population eats more than 2 servings of fruits and vegetables per day. How many should we eat? We should eat 5 to 7 to 10 servings of fruits and vegetables every single day. We don't do much better as cardiologists. This is a study we did that showed that the average cardiologist eats 3 servings of fruits and vegetables per day. Don't focus so much on Mediterranean or details of whether I want to eat this or that. Just focus on the foundation of every diet, which is more plants. We really want to focus primarily on eating a whole food plant-based diet, which is mostly greens, beans, legumes. These are the kind of foods we want to be eating. Definitely not this. This is the food we had to, when I first got to University of Florida, it used to be served to our cardiology fellows, and we've now gotten rid of that, thank goodness. Remember to eat 5 to 7 to 10 servings of fruits and vegetables per day. This is often something I do with my patients, which might help you, especially if you're transitioning from a plant diet to a plant diet. I'd often tell patients, let's just start with what you think you can do. And so often I'll tell you, remember, the goal is just to eat more plants. And if we're trying to, in terms of our elimination, we try to start with removing all the red meat. All the red meat has to go, no matter what. That's like one of the first ones for me, has to go. And then we start by removing the poultry, and then we move the fish. And sometimes people get stuck in different positions along the way, but I'm not somebody who, I really believe that you have to I do not let perfection be the enemy of good. So I really want people to eat mostly plant-based or 100% plant-based. But again, I really try to focus on eating more plants. So try to eliminate the red meat first, then the chicken, and then the fish. Try to get rid of all your milks and dairy. Eliminate your simple carbohydrates and your simple sugars for sure. Eliminate your processed foods and artificial sweeteners. Watch the omega-6-3 ratio. Our American foods primarily have a load of omega-6, which is pro-inflammatory, and we want to be eating more omega-3, which is anti-inflammatory. Avoid those trans fats. Eat 5 to 7 servings of fruits and vegetables, more complex carbs, and anti-inflammatory spices. So why don't we learn about this from our doctors? Well, this is a study we did, and it said that 1% of doctors believed they received a high level of nutrition education, that they gave them excellent skills for counseling patients. We just don't learn it. As doctors, we don't learn enough about nutrition, so we don't advocate it. I have patients that come to me all the time that say, my doctor doesn't believe in nutrition. Well, it's probably because they don't understand nutrition. So I'm at the University of Florida, and we focus a lot. I have a prevention clinic there. And what we do is we do 1 hour long visits, and we focus on yoga and meditation, loads of nutrition. And with that, we've shown data that shows that we've improved quality of life. Patients' blood pressures, cholesterol have all come down, and they're reducing their medications, which is awesome. You also changed the menu at the hospital. We have a 100% plant-based menu, which is so fun and cool, and all of our patients can eat off of this 100% plant menu, and we encourage all of our patients to eat this menu. We really focus on research. I'm always asking the questions of whether, is olive oil bad? Is olive oil good? Is there a certain amount of oil, or is there a certain amount of omega-3 or 6? How much fiber is the right amount of fiber? These are the questions I want to know. And these are the things that I often am doing research on and like to publish on, and always appreciate people getting excited about the research, which is so important. We're also teaching the next generation of doctors, where we do a CME conference. So that's a continuing medical education conference, where we teach doctors about how to eat and how to cook, which we did our first event right before COVID, and unfortunately can't do another event until we were hoping this year, but unfortunately with COVID, it'll probably be next year. I just want to remind you that this is an exciting time, that change is possible. You have to remember that you can do this. Anytime you feel a moment of angst or that you cannot, remember that I'm on your shoulder. People often say they have signs in their house that say WWAD, what would Aggarwal do? Some people often say that they have me on their shoulder and I help them make decisions when they're at the grocery store. I'd just like people to remember that you can do so much with your risk of illness and inflammation and heart disease and autoimmune disease by what you eat and how you treat yourself and treat your body. Your body is not meant to handle an unending amount of stress, too much physical stress. It needs to be nurtured and loved. And while we charge our cell phones, we need to remember to charge and learn to charge and restore ourselves. Remember to be empowered to know that you can do this and you can be part of the change. Remember this slide in particular and try to figure out what you're doing to remove the stressors in your life and adding in the resources to keep yourself healthy. So you have two choices. We could perform triple bypass surgery, where we can take a vein out of your thigh and open your chest so you can sew the vein onto your coronary artery. This costs $100,000 and will keep you laid up for at least 2 months. Or we could put you on a vegan diet. A vegan diet, GDoc, that sounds pretty extreme. And I'm going to finish there with a video. I can do a little video if we have 2 minutes, Megan, or we can just finish with questions.
Sorry, I was muted. Yeah, show the video. Well, that's great. I would love to see it.
Okay, so this is a little slide that just shows the thing we did at University of Florida to improve our menu and how people responded. I'll tell you beforehand as a commentary. It's kind of funny. The people in this it took me a year to get a plant-based menu approved at the University of Florida, and the dietary staff who are all over this video were my biggest enemies. not physical enemies, but these are the people that were the most resistant to the change. So I always sort of laugh at this, and you'll see in the video how fabulous they are. So it's good to see everybody can change, and you got to always remember that. Here we go. Hi there, how are you? Monica Aggarwal, nice to see you. So I've been in practice for 10 years, and I would admit that I've given out more Lipitor and Crestor prescriptions than most people, because as a cardiologist, that's what we do. What I found that is I kept feeling like I was just giving out more and more medicine, and yet I wasn't making people better somehow. And I also, like many people, feel that, what am I doing here? We as physicians are taught to tell people, well, eat better and exercise more. But we don't really tell people or give doctors the tools so that they can then counsel their patients better. And so what we're trying to do is change that model. I want people starting to realize that even as employees and staff of the hospital, that what you eat matters. The things that you do when you're young impact your whole future. Start changing your habits now and you'll be able to walk better longer. Your joints aren't going to hurt. You're not going to be a 30-year-old with diabetes. You know, all of these things change if you just make the first step now.
So about a year ago, Dr. Agarwal partnered with myself and the food nutrition team to conceptualize the introduction of a plant-based menu, specifically to start out with our patient population. We have really researched the benefits of introducing plant-based foods into daily cuisine for not even just our cardiac patients, but really our population as a whole, and some of the preventative benefits it does have to health. And then what we did was really work very closely, again, with our clinical team, with our culinary team, to design a plant-based menu that really does meet the food preferences of our population here in Gainesville, Florida.
We sat down multiple times throughout the past year, kind of brainstormed, developed different menus, different ideas.
We conducted meal tastings, including our nursing staff, as well as some other staff members in the organization, to get their buy-in and to tweak our recipes.
You get the dietary staff involved and you get them excited about it. And then you start teaching the nurses about what the food is and letting them taste it. And then they tell the patients, like, I tried this is really good. And then the patients start feeling less intimidated and less fear.
Sometimes when they look at the menu and they're a little bit hesitant to try something new, but once they do receive that meal, they're pleasantly surprised with the taste and the flavor of it.
You know, I think that's important to remember that we're not feeding people just lettuce. We're giving people fabulous food. It tastes good. There's different types of flavors.
We do a sweet potato kale hash. We do a lentil bolognese over pasta. We do a tofu vegetable stir fry.
Our next phase is to really start incorporating the plant-based items into our retail operations, such as our cafes, to really promote this same initiative and this same healthful philosophy to our employees and our visitors that come in our door every day.
Let's do this together. Let's not be afraid to make a little bit of a change in your hospital. It takes small steps at the beginning, but I'm confident that we can do it as a group.
You might have some people who might, tilt their head a little bit when they first hear it, but I guarantee if you work through that, and again, if you bring it to them and really engage them in the process, it can work. It can work, and it does work, and it really does make a difference.
People often say that it's hard to change, or that people can't change, and it's just easier to give out a medicine. Boy, I hear that all the time, sometimes every day. I don't agree with that. I think that change is hard, but change is good, and that it takes time. But I think that we underestimate sometimes what people are able to do. And so sometimes when you give people the tools, they will make the changes. Not always immediately, but they slowly do. Our job is to just start the process.
And I'm just going to leave that contact information on there in case there are any questions. Otherwise, thank you so much.
I honestly thoroughly enjoyed your presentation. I learned so much. I always feel like I know everything there's to know about this stuff at this point, but I feel like I learned something new every single day. Everyone who's here, if you have any questions, please feel free to type in the chat box. And of course, her email is right there. Twitter, Instagram, book. And it's funny, I myself normally have a billion questions, but you answered like everything I could possibly. You answered everything in your perfect slideshow.
Oh, I don't know. A lot of information can overwhelm sometimes.
No, it's overwhelming. And it's funny because I literally was just learning about TMAO. Did I say that right? TMAO?
Yeah.
Just recently. So it's funny that you actually spoke about that.
Oh,
okay, we have a question from Brian. What is your current diet?
So specifically what I eat, or in generalities?
Brian, you can actually unmute yourself if you prefer. He's asking if you're oil-free, 100% plant-based, I assume.
Oh, gotcha.
So no, I'm not 100% oil free. I eat a reduced amount of oil, very little, in fact. But I do have a little bit of oil in my diet. I eat 100% whole food, plant-based. Do I eat cookies once in a while? Sure. Do I have an Impossible Burger once in a while? Sure. Do I think Impossible Burgers are good for you? No. They are a gateway meat, veggie meat, so they're good for the environment, but not good for the body. So I like it as a transition meat, but unfortunately it's just not healthy for you. But do I eat them once in a while because people buy them for me? Yeah. So in general, I will eat, for instance, for breakfast, one of my biggest go-to breakfasts is whole rolled oats, and I don't cook them often because lately I've been into eating them cold because I'm in hot Florida. So I have been eating, I just pour some of the whole rolled oats. I like the Bob's Red Mill. I also like the Soulful Project, which I posted about on social media recently because I wanted to support them. And at the Soulful Project, so I just pour the oats into a bowl, a small bowl, and then I put in some oat milk or some almond milk, and then I put in lots of blueberries or how many blueberries I feel like, and that's what I often have for breakfast, and that's one of my favorite breakfasts. And sometimes I'll eat a half an avocado with that, or a banana, or sometimes I will have a piece of toast, a whole wheat toast with hummus and tomato, or hummus and sprouts, which are some of my go-to breakfasts. Do I eat some oil? A little bit. I make a lot of lentils because I'm Indian. So sometimes when I do onions at the beginning of making an Indian dish or something, I might put a tablespoon of oil or something like that into it. But in general, that's primarily all I will get. And that's going to be on a pound or two of lentils. So very little, if any, oil. What do you think of using a bit of melted butter or veggie butter? Yeah, I mean, I guess the thing is that, look, it all depends on what your numbers are and where you are in the process. Does it matter if my husband likes that veggie butter. Is it good for you? No. You need to understand that it's not good for you. And you just have to understand that if once in a while you want to have a little bit on a piece of toast, or I'm not gonna, okay. The goal is always to eat mostly plants, and I can't emphasize that enough. And so if once in a while you want to have a little bit of butter, you should really, as a cardiac patient, if you're a cardiac patient, you will know that your cholesterol will go up if you eat those kind of foods. But if your cholesterol is fabulous and you really just can't live without your butter, there's no judgment for me. I do not believe in judging my patients. I believe that we're all in this process of growing and getting better together. And so eventually want you to work on maybe cutting a little bit out, and getting a little less, but do your best.
As a parent, can I ask you a question?
Yeah.
My son's 5, he's plant-based. And, I worry about the future when he's surrounded by elementary school kids and going to people's houses. Are your kids plant-based, and how do they deal with it? And
Yeah.
the audience may have grandchildren or kids of their own, so maybe they like my question as well.
Sure. Yeah. So that's a question I get a lot too. And so, yeah, so my kids are 100% plant-based as well. But if we go out and eat, or if they go to a party, I say absolutely nothing. So so they'll eat a cupcake, they'll eat chicken nuggets once in a while, and I say absolutely nothing, because I believe the way I like to parent, and again, I don't know if I'm doing it right, is that I'm trying to teach them good habits at home. So the food that they get in my house, which is primarily everything they eat 360 days of the year, or 355 or something like, then they will eat the whole food plant-based foods that I provide them. And then when we go out, if they choose to eat something else, they look at me sometimes and say, "Is this okay, Mama?" And I'll say, "Baby, it's your decision." And so they decide what they want. And sometimes they buy something and they try it and they say, "I don't really like it." And sometimes, my daughter came home one day and she said, "Mama, I tried this thing called Lay's." And it was like, okay. And so it was Lay's potato chips. And she said, I tried it. It's called Lay's potato chips. And I said, okay. I was like, how were they? And she says, terrible. And so, but once in a while they like something and I try to support it. They wanted to try pudding. I bought pudding. They wanted to try Jello. I almost died buying it, but I bought it and I let them try it because I never want to be the type of person that my kids feel like I held them back. And what I've found is that they prefer plant-based foods. And so I have found that they know now what those things are like, and they've chosen against them. So I don't know. I don't know how it's going to all, but I never want them to. I've seen many children who go through a high school, college rebellion, and they say, "Screw all this! I'm going to eat what I want." And they eat pizzas and the junk and all the food that we don't want them to eat. And so I find that if I take away the mystery, I'm hoping that it won't be such an excitement when they're on their own. That's the long version. Sorry.
No, that's a good answer. I like that answer. Does anyone else have any questions from the audience?
Well, thank you so much. I appreciate it being here.
Oh, I do.
All right, Kathy has a question.
Sure, Kathy.
Yeah, I've never found a plant-based milk for my coffee that comes anywhere near the satisfaction of like non-dairy creamers. I was using maybe a tablespoon a day of non-dairy creamer for a good while because I just couldn't stand my almond milk or whatever kind in my coffee. So I finally stopped drinking coffee and just drink tea now because nothing feels good. And I didn't really want to keep on with the non-dairy creamer. Anybody know of anything that kind of reaches that satisfaction that creamers reach?
A lot, actually. I hear that in my clinic a lot that, that people want their coffee. So I always love when I switch person to a tea because I'm a tea drinker, not a coffee drinker. So I always like that. So, but I appreciate the dilemma. And so typically soy milk works the best because it's the thickest. Some people like coconut milk. I'm not a huge fan of coconut milk because, and so I like to avoid that. But if, the soy milk might work for you. There are these things called nut pods and that are not as bad sort of as the non-dairy creamers. Again, not my favorite, but might be a good transition for you. Or they're called nut pods. And you can look at those. But have you tried soy milk?
I can't remember if I did or not, but perhaps not.
Yeah, almond milk is so thin, and so soy milk is thicker. Go ahead. I'm sorry, Megan.
I drink my coffee black, but my husband went through the same dilemma, and he discovered Oatly when he was in Europe, and Oatly is now here in the States.
Yeah.
And he likes all the different options of Oatly, but they do make a barista line on their website, which is specifically made for coffee. So I know it's really thick and creamy. So that was the first one that he found success with.
Okay, that's a good thought.
So Oatly.
Yeah, so Oatly.
How do you spell that? I can't hear exactly.
I typed into the chat box O-A-L-E-Y.
Oh, thank you.
It's because it's made from oats. But if you go Google Oatly and go on their website, that way you can look what the boxes look like, and then you can find it in the grocery store. And almost all grocery stores carry it now.
Okay, thanks.
Yeah. Well, if any of you have any questions later on, I'm queen of thinking of questions after any kind of event. Feel free to email me, megan@pbnsg.org. You'll find my email on the PBNSG website, and I'll email Dr. Aggarwal about whatever you have that comes into your mind later on tonight. Thank you so much for that phenomenal presentation, and thank you for doing what you're doing, that transition in careers to help promote this education among everyone who honestly needs it. Thank you so much. And your book looks phenomenal. I can't wait to share your name, your website, your Instagram with my friends and my family. For those, again, I just want to remind you that our next event is on the 22nd with Chef Karen Dugan. It's a culinary event.
Karen's great.
Oh, yes, that's what I've heard as well. It'll be phenomenal. And then we have Adam Sudd on July 29th. So um, thank you again, everyone, for being here. Don't forget to go to our website, pbnsg.org, and check out all that we're offering and share it with friends, family, friends of friends, the membership. We're growing as much as we can just so we can help as many people as possible. Thank you again. I'm going to end the meeting or the event. And thank you again, Doctor. We're so happy to have had you tonight.
Thanks for watching and for being a part of the PBNSG community. If you found this video helpful, be sure to give it a thumbs up and subscribe to our channel for even more plant-based insights, expert interviews, and delicious recipes.